Hello, my name is Tom Dobrzynski. I'm a paramedic at FM Ambulance. In the pre-hospital setting, 12 leads are becoming more and more common to diagnose patients having myocardial infarctions, otherwise known as heart attacks. According to GEMS, the Journal of Emergency Medical Services, 12 leads done in the field pre-hospitally can significantly reduce the time it takes for reperfusion of patients having heart attacks. In order to provide hospitals with good solid diagnosis of these patients, we need to have a good understanding of how to take a good quality 12 lead in the field. Today we're going to take a 12 lead using this monitor right here. It's a LifePak 12 made by Seesion2. Some of the things that we need to be familiar with is that it has one set of cables for your 4 lead and then a second set for the precardial leads. On the monitor itself, we have the on button over here, and then on this side of the monitor is where we're actually going to have the button for taking the 12 lead. In order to take a good 12 lead, we need to know proper placement of putting leads onto the chest. According to 12 lead, the art of interpretation, the best placement for 12 leads is first taking your 4 leads and going by what it says on your leads. You're going to place them on the right arm or right shoulder, left arm or left shoulder, left leg, and right leg. For these leads, it's not necessarily important that they're placed on the extremities, but they do need to be at least 10 centimeters away from the heart. Going to the precardial leads, we'll be using this trunk cable, and we'll start off with leads 1 and 2. We're going to count down to the 4th intercostal space, and on each side of the sternum, we're going to put V1, and then on the left side of the sternum, V2. Then we will count down one more to the 5th intercostal space, and we'll put V4. At that point, in between V1 or V2 and V4, we will place V3. And then going down to the side, we are going to put V6 at the mid-axillary, and then V5 right between V6 and V4. Not only is it necessary to know proper placement of the 12 leads, but in order to get a nice quality 12 lead, we also need to know how to troubleshoot if we have a wandering baseline or artifact. According to the manual of Seesion2, if we find ourselves having lots of artifact, there's a few steps that we can do to ensure a higher quality. One is making sure that the leads, the wires that we're using aren't frayed, that they're all intact. Also making sure that all the wires are as straight as possible, not crossing over each other as much as possible. The electrodes that we use, we want to ensure that the electrodes are moist, that they're not dry, also that they're not expired, so that they have good contact. Also making sure that you have good patient preparation, and if there's any loose contact, you might have to re-prep by cleaning the patient's sites off. Sometimes shaving the patient's chest of hair is also required. Another trick that we can do is by placing a blanket over a patient. Sometimes we can reduce the amount a patient shivers in order to get that better quality 12 lead. Once we have the wires placed, we're going to hit the on button. We will go over to the 12 lead, enter the patient's age with the dial, and hit enter. At this point, the machine will take the 12 lead, and we'll be able to have a good quality 12 lead. Proper placement of the 12 lead is a very important step in the pre-hospital setting. For those of us that are in the pre-hospital setting that want to have the greatest impact for our patients, we need to understand the importance of having good placement and good quality 12 leads for accurate diagnosis of our patients. Thank you for your time.